It's super frustrating when your hard effort at treating SIBO didn't work. In today's video, I'm going to talk about why your SIBO treatment may not have worked and what you can do about it. I'm Amanda Malacheski, certified functional health coach and digestive and allergy detective. If you could use some help understanding why you have digestive symptoms and what you can do about it, subscribe to my channel and make sure to hit the bell to be notified when I post a new video every Monday. Have you tried to treat SIBO and been let down by the results? In today's video, I'm going to talk about some of the reasons why your SIBO treatment may not have worked and how you may need to adjust some of your thinking and approach to get where you'd like to go. So maybe you've tried some of the antibiotic or herbal treatment protocols for SIBO and you just haven't seen the results that you're hoping for. So the first thing I need to say about SIBO is that you're not going to get the results that you're looking for by just protocol shopping. But if they keep not working, there's a reason they're not working. And your job is to actually figure out why your body isn't responding. What are we missing? What are we skipping? What are we glossing over that's making it not work? So to really fully resolve SIBO is often a 6 to 12 month or even longer process, especially if you are struggling with methane-based SIBO. There are several aspects to treating SIBO that are really important and they all need to be met. And these include not only the antimicrobial agents, which can be either antibiotics or herbs. So the first suggestion that I really want to make sure that people follow is to recommit to their therapeutic diet that is really helping their SIBO. So for most people with SIBO, this is either a low FODMAP or an SCD diet. And if you need more information about the low FODMAP diet, I have a video and I'll put the link below for you. The next tip I want to suggest is to investigate other gut infections, particularly if you are struggling with H. pylori, with parasites or worms. It's going to be really difficult for your digestive system to heal if you aren't addressing those infections first. So you might want to consider getting a stool test. And if you want to learn a little bit more about that, you can check out my earlier video called Stool Testing for IBS and SIBO. The second thing you can really do to support your SIBO is to make sure that you are including motility supports. So this can include prescription medications, things like low-dose naltrexone, or other medications that your MD or functional medicine doctor may be able to prescribe for you. But it can also include herbal supports. There's one called MotilPro that I've used by Pure Encapsulations, and that is primarily ginger. Ginger is a prokinetic. So you can also just include a lot of fresh ginger in your cooking in the kitchen. So additional motility supports that you might be able to make use of include getting abdominal massage, either from a massage therapist or physical therapist in your area. And this can help break up scar tissue that may be holding your intestines tight and not allowing them to digest well or help things move through. You can also work on vagus nerve stimulation and healing. And like I said, I mentioned that in an earlier video called Digestive Tips for IBS and SIBO. Have you had a SIBO recurrence? Let me know in the comments, yes or no, and how many times you've done a SIBO treatment protocol. And you can also increase the period of fasting between your meals and certainly overnight. So for example, this might look like eating your dinner a little on the early side, like around 5 or 6 o'clock, and not eating anything all the way until the next morning. I want you to make sure that you're getting consistent and regular physical activity or exercise, even if this is just a basic daily walk or a little gentle stretching. It's worth checking out a yoga class that focuses on supporting digestion or focusing on yoga poses like twisting in particular can really help mobilize what's happening in the gut. A few additional things to consider if you keep treating and not seeing results is your stress. How's your stress level? What's going on with that and what could you do to address it? The next thing you can really make sure to give attention to are the basic digestive supports. And just to summarize them really quickly here, you have your basic stomach acid support, enzyme support, probiotics. But there are other aspects to that, and I encourage you to check out my video, Digestive Tips for IBS and SIBO, because there's 9 of them in there that I go into in a little bit more detail. And one last option for people who are repeatedly treating their SIBO and not seeing results is to try using what's called an elemental diet. An elemental diet is like a liquid meal replacer that replaces all of your nutrients with elements essentially that are broken down to their smallest level. So your body doesn't have to work to do the digestive process very hard. This basically gives your digestive system a pretty significant rest, and it allows it to do its normal healing process. So there are several elemental diet products on the market. You may need a healthcare practitioner to access them. There's also some resources about homemade varieties, although they typically don't taste very good. Like I said, there's one by Integrative Therapeutics that doesn't even taste so bad, and you can talk to me about that if you want to hear more about that. And there's also a new one by Dr. Ruscio. You can find that probably over on his website, which is Dr. Ruscio, RUSCIO.com. So check that out if you have been repeatedly trying to treat your SIBO and you're not getting anywhere. Now that we've talked about why your SIBO treatment may not have worked, I'd like to hear from you. So tell me about your SIBO in the comments below if you'd like. If you're out of options and you feel like you need help from someone to investigate and troubleshoot your SIBO recurrence, I'd like to invite you to meet with me over the phone to help you determine how I could help you sort out your most supportive diet or underlying causes. You can schedule a free assessment session with me by visiting my website, confluencenutrition.com/contact, and by using my online appointment scheduler to talk further. I also have a private Facebook group called Hope for Healing Chronic Illness where you can ask questions of me and our community, so come check us out. If you like this video, please let me know by liking it below, subscribe, and share with your fellow digestively challenged friends or families, and comment below with helpful if this video helped you. Bye for now.